Hello everyone, I am Beatrice. In today's video, we'll look at some common over-the-counter respiratory medications. We'll be focusing on basically 4 classes. Now we'll be looking at the mode of action, the condition where these medications are used, side effects you need to know as a nurse or as a nursing student, and patient teaching. If you're ready for today's video, let's begin. Now, the first class of medication we'll look at is mucolytics. So from the name mucolytics, so breaking of mucus, because lytis has to do with to break something. So breaking of thick mucus. So the mode of action of mucolytics is to break disulfide bond in mucus. So any condition where a patient produces a very thick mucus, like in cystic fibrosis, mucolytics are administered. A popular mucolytic is acetylcysteine, or what we call mucomist. Now, one thing I want you to note concerning acetylcysteine is that it's also used as an antidote for acetaminophen overdose, that's Tylenol overdose. Now, for the side effect of mucolytics, one of them is bronchospasm. And that means for any patients that already have a disease where they experience bronchospasm, it has to be given cautiously. In most cases, they prescribe a bronchodilator together with mucolytics for patients that have asthma or COPD. Another side effect is GI disturbances, like nausea, vomiting. Now, teaching. Well, one thing you need to know about acetylcysteine is that it has a strong sulfur odor. So you need to let the patient know so that they are not surprised. And like I mentioned before, this medication should be used cautiously in COPD patients, in asthma patients, or any patient that experiences bronchospasm or at risk of bronchospasm. The next class of medication we'll be looking at is the expectorant. So from the name too, you can predict expectorant to help expel mucus. So the mode of action is to decrease mucus viscosity. In other words, also making mucus less thick, makes it lighter. And the way it does that is to thin mucus and promote productive cough. An example of medication in this class is guaifenesin. Is used for cough, especially cough that is not productive. When given, especially when patient also take it with a lot of water, it thins that mucus and make it easy to expel. Now, side effect you should know for expectorant is that it can cause things like dizziness, drowsiness, headache, and also GI upset. So because of that, when you see any medication that can cause dizziness, drowsiness, that means for teaching, there has to be a fall precaution for patients so that patient does not fall and injure themselves. Now, also for medication that also causes dizziness, drowsiness, it should not be used with alcohol or any sedating drug because it will worsen that sedation. Now, also this medication should be taken with lots of water. It's going to help in thinning that mucus. So patients should be encouraged to take a lot of water when they are taking expectorant. Now, the third class of medication we'll be looking at is decongestant. So as the name goes, decongestant, to decongest all those stuffiness the patient will feel. So it's in other words used for rhinitis. Another name for decongestant are what we call sympathomimetics. An example is pseudoephedrine, and the mode of action is to stimulate alpha-adrenergic receptors. So we know that alpha-adrenergic receptors are responsible for vasoconstriction. So the essence is to cause vasoconstriction so that it can decrease swelling and decrease that nasal congestion. Now, the side effects you should know is that decongestant can cause insomnia, can cause palpitation, nervousness, tachycardia, even hypertension, and rebound congestion, especially when the patient stops using it. Now, because of this side effect, when you are teaching a patient that is on decongestant, you should mention to them that if they have conditions like hypertension, especially uncontrolled hypertension, they are not encouraged to take decongestant. Even hyperthyroidism, glaucoma, because of that constriction effect, it can worsen their condition. The fourth class of medication is antihistamine. Antihistamine is for allergy, for rhinitis also, because the activities of histamine in most cases is to cause anything that has to do with allergy, like rhinorrhea, sneezing, itchiness, watery eyes. So the essence of antihistamine is against histamine, is to block histamine H1 receptors, stop it from causing all those symptoms of allergy. So in essence, it will lead to reduced symptoms of those allergy. It's also used in urticaria, which is hives and motion sickness. Now, another thing you need to know about antihistamines is that they have first generation and second generation. The second generation was produced because of too many side effects that come with the first generation. An example of medication in the first generation is diphenhydramine, that our popular Benadryl. And for second generation, where we have loratadine, that's Claritin, we have cetirizine, which is Zytec. Now, for the side effect, it's so common with the first generation antihistamines. So things that has to do with drowsiness, dizziness. So because of that, we initiate fall precaution also for a patient that is taking antihistamine, especially first generation antihistamine. Another side effect that is also unique to antihistamine are things that has to do with anticholinergic effect, like dry mouth, constipation, urinary retention, blood vision. So whenever we remember anticholinergic effects, where you talk about a patient not being able to spit, or being able to urinate, or being able to see properly, or when they are not able to poop or defecate or go to the toilet. So these are things that are unique. And this medication too can cause photosensitivity. And for patient teaching, like I mentioned, fall prevention is a must because of that effect of drowsiness. And then patients should avoid anything alcohol or opioid, anything that can worsen that sedation. Patients should avoid it when they are on antihistamine. So that wraps up today's topic on common over-the-counter respiratory medications. If you find this video useful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.